right, so I'm going to go ahead and get started. My name is KReyes. I go to George Bush High School. My mentorship took place at the Center for Women's Health, which is a OBGYN clinic. I was able to shadow doctors and even see some interesting surgical procedures throughout the entire program. So to begin, my research endeavor covers short interpregnancy intervals, which describes the time between two different pregnancies. Typically, a doctor recommends waiting about 6 months to a year before conceiving again, especially if the patient has already had a previous cesarean section. The reason behind it's pretty simple. The entire body adapts to a living being within the uterus over the span of about 40 weeks. As soon as the baby is born, the body does not recognize this right away, and major adjustments are made, For example, the placenta is removed from the uterus during labor, which the body learns to stop providing oxygen and nutrients to this vital organ. The pressure on the bladder and colon begins to decrease, and the elasticity within the vagina and cervix allows for the size to shrink down over a long period of time. The mother's healing process can also be difficult. Some women experience constant bleeding or an uncontrollable bladder within days of the delivery. The variance from patient to patient is pretty difficult to track, so a generic healing time of at least 6 months is heavily recommended. Moving on, there was a study in 2017 that looked at 38,178 women. They each had at least 2 pregnancy intervals, and the sample took place from 2000 to 2015. The length of the interpregnancy intervals varied from 0 to 60 months, and the main factors that were measured were low weight, preterm birth, small gestational size, use of neonatal care, and maternal outcomes. The results showed that there was a significant risk for gestational diabetes with a z-score of about 1.35 and a risk for subsequent pregnancy obesity with a z-score of 1.61. The chances of preterm birth within an interval of 0 to 5 months were about 12.8% compared to 8% of births between 18 to 23 months. Another endeavor in 2011 tested the outcomes of short intervals on low-income neighborhoods. In specific, it looked at the chances of preterm births or intrauterine growth restriction, in other words, the lack of supplied nutrients. After conducting the experiment with 440 women with 2 consecutive births, it's safe to say that there was a positive association with age of the mother and the outcomes expected. The percentage of preterm births increased as the length of the intervals increased, but only for the mothers who didn't have a previous preterm birth. The correlation between the outcomes and the lower income areas was hard to measure numerically, but the ending conclusions covered the importance of educating women on the risks of short interpregnancy intervals. A study in 2017 measured the correlation between uterine scarring and cesarean sections. The reason I included this in my final presentation is because the link between short interval pregnancies and C-sections can be even more detrimental than they already are. However, the accuracy of the study is inconclusive since it was evaluated from 1 patient alone. A woman in the case study experienced lower abdominal pains after a C-section, unsure of the cause. She had 2 previous miscarriages as well. She required an emergency C-section at 32 weeks because of her severe case of preeclampsia, and this was because her lower uterine segment was not fully developed. A lower uterine segment aids the mother in dilating the cervix when in labor, so it's pretty key to have this developed by this time. This was the primary risk factor, considering the segment is vital for both the mother and the baby when the delivery time comes. She had a post-operative heavy period and was not discharged until the 6th day. The importance of the study is the possible outcome of an asymptomatic uterine scar during a pregnancy. Finally, a study from 2011 observed the disparities between different races that are relative to preterm births. So after looking at hundreds of women with intervals less than or more than 11 months, they found that women who have intervals shorter than 6 months are 40% more likely to have a preterm birth. However, it was also conclusive that African American women are 1.8 times more likely to have the preterm births within that time frame. The gap between African American women and Caucasian women is about 4% when looking at preterm births. This number is distinctive enough to promote education amongst the different racial groups and just to women in general. Our research endeavor was performed through patient records of new obstetric patients with shorter intervals. So these records included doctor's notes, previous labs, family history, and their previous operations and medications. The intervals of the women varied between 1 to 10 months, and the major trends were observed. A total of 24 women were looked at within the span of 4 months. One thing I would like to include is that the sample size was definitely lower than expected, and it doesn't accurately represent the population. The results cannot be ruled as significantly affected, but background research can help support its results. Amongst the qualitative data from the patients, the main factors that reappeared were gestational diabetes, morbid obesity, unintentional conceiving, birth defects, premature infants, and questionable birth control. According to the table provided, roughly 17% of the patients examined experienced gestational diabetes, and 33% had some form of a birth defect, which means a preterm birth, heart problems, etc. 58% were on birth control at the time after the initial pregnancy or planned on starting it, and 54% of the pregnancies within these short intervals were unplanned. In addition to that, about 83% of these patients also had a C-section, which can create an entirely new list of risk factors for the mother. In other words, the vast majority of the patients within a shorter interval required an emergency C-section or wanted an elective one. This is just a better visual for the numbers provided, and after conducting the data, it is safe to say that education should definitely be encouraged. To conclude, the risks of short interval pregnancies are significant enough to encourage education in the younger crowd and to reconsider contraceptive decisions, especially right after delivery. The correlation between preterm births, unplanned pregnancies, and gestational diabetes all linked to the interval sizes. The women who had an interval within 6 months or less seemed to relate to the unplanned aspects, as well as the risks for preterm births. It was hard to measure the validity of this endeavor considering its sample size. However, its relationship to the risk factors is still pretty apparent. If this experiment were to be conducted again, the changes to be made would be sample size, methods of gathering data, and the risk factors measured. This experiment is generic compared to its endless possibilities to observe, and these conditions that were previously mentioned in the introduction are completed now. Yes, birth defects are positively associated with shorter intervals compared to greater waiting periods. Only 46% of the intervals were planned out of this sample, meaning that the intervals between were not intentional whatsoever. Birth control was involved when looking at the women's intentions, and 58% of them either considered it after the pregnancy or were already on it within the time being. Collectively, the long-term impact affects the future of young women, so the importance of educating individuals is key to preventing these liabilities. And these are my sources provided in MLA format. I had a longer list for a general idea of background research, but these are the few that I directly referenced in this presentation. And I also wanted to briefly thank the FBISD GT mentorship team and my mentor, Mrs. Yolanda. This is a once-in-a-lifetime opportunity, and I could not have been more grateful to have experienced that. So that is it. Thank you for tuning in.